So we support each other in joy. We support each other in sadness. We support each other in development. And this is what I would like to see happen on an Africa scale.
Her Excellency, Mrs. Toyin Ojora Saraki, philanthropist, businesswoman, wife, mother, and a woman with a big vision and passion for Africa. With a focus on maternal and child health, Toyin set up the Wellbeing Foundation Africa to build sustainable change for African families and reverse the cycle of poverty on the continent. Nigeria is one of the worst countries in the world to be an expectant mother, contributing to 10% of worldwide maternal deaths. Globally, approximately 800 women die every day due to pregnancy and childbirth-related complications. The majority of these deaths are preventable. The plight of mothers across Nigeria and Africa is a passion very close to Toyin's heart.
I was pregnant and I was expecting twins. A few days before my wedding, everything went awry. And basically, I began to hemorrhage. I found myself in hospital in this situation which was beyond my contemplation. I never even knew things like that happened to people. I had my daughter naturally, and then my daughter's twin got stuck. And there was this life-changing delay, which meant that the next baby came out stillbirth. To cut a long story short, in 24 hours, I got married, had a child, and lost a child. What I experienced was an unavoidable reality for the majority of the women in my country. The inadequacies of the Nigerian health system, the lack of reliable information, the absence of an effective referral system. I've seen babies die because their blood types were not compatible with that of their mother. I've seen children die because the parents can't pay the registration fee to access the free care in the hospitals. I've seen lives lost because even in the same facility, they don't want to marry the health of the newborn to that of the mother. And yet, because of my experience, I've also seen the way systems that are supposed to work properly do work properly. I've seen the synergy of mother, child, system, doctor, research facility, records, and I just wanted to know how to bring this synergy to my own country.
This traumatic experience was the inspiration for the Wellbeing Foundation's flagship initiative.
Basically, we discovered that in Nigeria, it's been very, very difficult for us to ensure a continuum of care. I looked at a few countries all over the world that have very, very good survival rates, and I realized that they all have one thing in common. They're all using home-based, which is patient custody, health records.
Plans are in place to digitize the personal health records to increase access geographically. Another initiative, the Mama Kit, contains essential items used to assist in the safe delivery of babies. Evidence has indicated that use of the kits results in substantially less infections, the third leading cause of neonatal deaths. The Wellbeing Foundation Africa provides health aid that targets the most vulnerable in society, counselling and home-based care for those affected by HIV and AIDS, and training for midwives. Empowerment is a core focus of all frontline programs. The provision of useful equipment enables local women to establish themselves as trade entrepreneurs. On a global level, the Foundation is now one of the foremost advocacy organizations working for maternal and child health, domestic violence, improved access to midwifery, inclusive access to finance, and increasing demand for universal health coverage. Through social media campaigns such as #Maternal Mondays, the Foundation raises awareness and generates discussion around maternal health. As well as its own campaigns, the Foundation works with partners to generate a louder voice for women and children in need. In 2011, it partnered with the Every Woman, Every Child initiative. Since then, in the spirit of MDG 8, the Foundation has continued to grow its partnerships to achieve sustainable change.
So it's with huge pleasure that I introduce to you Her Excellency Toyin Saraki, the ICM's first Global Ambassador.
In my country, we say, if you want to go fast, you go alone. But if you want to go far, you go together. And it is my prayer that together with the ICM, we will be able to go both fast and far. Thank you.
The Wellbeing Foundation Africa continues to dedicate its work to achieving MDGs 4 and 5 and shaping the post-2015 agenda.
This will be a movement that will empower every single woman, every single girl, and by extension, because we're family people, our families, our communities, and our nations. Thank you so much.